kulang na kulang yung support. You read in the news that they got billions of loans, pero hindi naman natin na-feel.
The DOH is confirming.
In January 2020, the Philippines recorded its first case of COVID-19, then called SARS-CoV-2. As preventive measures, the government implemented protocols that people weren't accustomed to, such as wearing face masks, physical distancing, disinfecting of surfaces, and contact tracing.
Nakakalito talaga yung quarantine. Well, first, it helped nung umpisa. It really helped lessen the exposure. Makikita naman natin dun sa mga average daily new patients. Once the quarantine was made in effect, nakita na talaga natin na bumababa yung mga number of cases. Nakakalito lang. Okay? Nakakalito lang. Hindi siya masyadong naiintindihan ng tao. We have protocols, pero hindi naman nai-enforce. It's frustrating a little kung ano ba yung gusto talaga ng government natin na ipatupad.
Confusing enough for the people, confusing still for our frontliners. These brave individuals are not only dealing with different illnesses and their patients, but also with the government and its neglect.
They should have a higher pay kasi especially those talaga working in the COVID wards. So actually not just the healthcare workers I mean, in the hospital, meron din tayo mga orderlies, the guards, the allied healthcare professionals in each department. Yung ganong healthcare workers, sometimes hindi nila nakukuha talaga yung parang pay nila na ito yung dapat, pero hindi talaga nila nakukuha. We cannot naman expect too much because we know that the Philippines is a low middle income country. We rely so much on donations. Parang there is no single leadership that we will follow. If there was one authoritative or reliable figure sa DOH na susundan natin, siguro sa talaga makikinig tayo sa kanila. Pero since merong mga sinasabi na mga feeling natin kulang, feeling natin late, na announcements, we rely on other sources parang to fill that gap na we feel secure. The Philippine Health Insurance Company that is supposed to shoulder the expenses of most of our countrymen, yung office nila is hounded by so much graft and corruption ever since, di ba? The leaders that were assigned to lead those government offices and even dito, di ba, yung leader natin, they're all military personnel, they're all generals. So it's kind of frustrating for us na yung healthcare needs ng tao will be headed by non-healthcare professionals. The pandemic na highlight yung kakulangan ng healthcare services.
The government's shortcomings rises to people's support, community pantries, donation drives, advocacy campaigns, programs, and seminars. Definitely more than low pay, lessened benefits, and overpricing.
The first few months of the pandemic, we saw the help of the private sector in regards to our healthcare workers and frontliners. Feel namin talaga yung care nila because common people, even big companies, no, they'll just bring food for yung may duty sa hospital. We're very grateful for those efforts.
Even before the onset of COVID-19, there have constantly been problems in the health sector. The pandemic has only been a chance for a government's neglect to become more obvious to the public. From mishandling and misplacing funds to condemning doctors, the Philippines' healthcare system has suffered mistreatment for so many years.
But we can stop this. This year, the Filipino people will be choosing who they want to lead them into better circumstances, better conditions, and better care.
We want a leader who walks the talk. We want a leader who recognizes the efforts of each sector, no, that can contribute to the growth of a nation. Hindi yung they'll just make promises just to get the votes. We want a leader who has integrity, who has moral values, who respects life, who is also hardworking. So hindi lang siya yung parang nag-uutos-utos. We want someone who really knows what's happening and responds to the problems. What we need to do is to be more understanding of others and be more caring. Because if you care for someone, you will follow the protocol. If you know the virus works that way and you care for people, you will do what is necessary. You don't need to hear what the doctors or what the government officials have to say. Just continue caring for one another, continue following, be more patient, and we'll get through this pandemic.
We have a lot to offer amidst the pandemic. Oftentimes, we miss out on various opportunities given in our country.
Many are suffering. Healthcare workers' safety and well-being are threatened and in many cases compromised.
What our healthcare system seeks is not help, but rather a shift in government for a better welfare.
While our modern heroes have long been disturbed because of numerous mistreatments they have to endure, we can be a way for them to be heard. We can be a voice.
The government may occasionally come to our aid, but this is not always the truth. Let us not forget to save our healthcare providers. Let us vote, educate, and learn. We can help our country if we do it together.